Today, the Philippines has its first confirmed case, a 38-year-old woman from Wuhan.
I'm here to advise you that we now have a confirmed case of the 2019 novel coronavirus in Victoria, the first case in Australia.
Brazil has confirmed it's the first case, the first in Latin America.
France was the first country in Europe to confirm cases of coronavirus.
The Centers for Disease Control and Prevention has confirmed the first U.S. case has been detected.
The death toll across Africa remains much lower than in Europe or the US, but health experts are nevertheless concerned about how this pandemic could affect the world's poorest continent.
The COVID-19 made an alarming impact among different countries, and we cannot deny the fact that while it has grown worse for other countries, others are winning on it. Because of this, different strategies were implemented by different countries which help resolve the active cases in their own way. So the question is, how are these countries making an action out of it? Today, we will be tackling 6 countries on how they are managing the COVID-19 situation. Number 1. China.
Starting with China, the origin of the virus, they had to implement strict measures, especially when the outbreak has occurred. By late February, authorities went door to door in Wuhan for health checks and forcibly isolating every resident, even separating parents from their young kids who displayed symptoms of the virus, no matter how mild. There were also drones hovering above streets to yell at people to get inside and scold them for not wearing masks. The country had a mandatory phone app that color-coded people for their contagion risk to determine who could and could not enter malls. A couple of videos resurfaced online. Chinese authorities welding doors shut to an entire apartment building in Wuhan with the residents locked inside, citizens who violated prevention measures tied to a pole or being publicly humiliated, etc. These policies made China left with only 409 cases as of July 9, out of the 83,542 cases. Their management seems related to the approach of Maitism. As Maitism imposes, rulers dictate what is right and wrong, while those who are weak are to follow and obey. The government of China used the power they possessed and controlled the people of China, dictating what people can and cannot do, even forcing them into allowing it. However wrong their approaches to other countries, the statistics of the cases in the country is enough proof that the approach was effective for them.
Number 2. Australia.
Australia managed to lessen its cases as early as possible, with only 485 active cases out of the total 8,255 cases. On the 27th of February, the Prime Minister activated the Australian Health Sector Emergency Response Plan for novel coronavirus or COVID-19. The ongoing upgrades at health campuses were postponed, accommodating patients with the virus. Just like any other countries, social distancing measures were increasingly tightened in late March or early April. Overseas travels are banned, and any arrivals in Australia are quarantined for 14 days. Wage subsidies were provided to support households, businesses, and investment incentives for regions and industries that are most affected by the pandemic. With the strategy ongoing and still implemented, it was observed to be related to the approach of full utilitarianism, because this action was done to benefit the people in the country. Deontology ethical theory is also considered because it shows the conflict between following the law and adhering to one's personal needs. Due to the rapid increase in the number of infected people outside of China, the Prime Minister made actions to make sure that the country would not be infected while also considering the fairness of the law.
Number 3. South Korea.
For the country of South Korea, as of July 2, only 938 active cases were left out of the total 12,979 cases. Making sure that those numbers would go down as the day passes, policies were adjusted. People are informed of the medical system and what process they need to undergo and follow once there is a suspected infection. And to minimize people-to-people interactions, symptoms are assessed and initial assessment is provided by phone. And if suspected of infection, the patient will be brought to a COVID-19 testing site. Once positive, is immediately brought to a quarantine environment to receive medical care. With the practice transparency, people with a direct contact with a positive tested citizen are to be immediately tested, and indirect contacts are to undergo self-quarantine at their home for 14 days. Instead of a full-scale lockdown, it relied on mass testing, tracking technology, and contact tracing. While the country has largely relied on urging people to socially distance, it also introduced measures like closing schools and urging companies to give employees flexible time off. Without having to choke off their economy, South Korea started the new daily life with COVID-19. They moved gradually and safely closer to resemble everyday life before the pandemic, but while keeping a vigilant eye out for any sign of backsliding. The way South Korea has managed a situation heavily dependent on the approach of deontology, without having to be strict and trusting the citizens to know what is right and wrong to do by the few rules and systems that the government have implemented while facing the pandemic. South Korea became an exemplary on handling the COVID-19 situation, while people are given freedom to live their life as close as to how it was before the pandemic occurred. The government implemented rules to follow if people go outside.
Number 4. Indonesia.
For the Indonesian people, Indonesia still is far from its goal, especially with 30,091 cases as of July 9. For this strategy, containment measures were implemented such as temporary travel bans on air and sea transportations. The government also banned Indonesia's traditional annual exodus for Muslim holidays in an effort to curb the spread of the virus from Jakarta and other high-risk regions. Indonesia has recently begun easing some containment measures under a new normal. The city of Jakarta has started a transitional phase from large-scale social restrictions on June 5th and further eased restrictions on malls on June 15th and parks and recreation areas on June 20th. With their implementations of banning some of its recreational activities, it's somehow related to the approach of utilitarianism. Even though Indonesia is mostly a Muslim country, the government banned any form of mass celebrations in public, which also included traditional and religious gatherings. This means that the government prioritized the safety of the people by putting them in quarantine. Moreover, the lockdown period can damage the country's economy, but the government still pursued this. Even though the consequences of this action is unknown, the current priority was to save lives rather than to earn money.
Number 5. Sweden.
Sweden, on the other hand, has a total of 56,025 cases as of July 9, and with only 16 recovered cases. Sweden was the only European country to not follow the policies implemented on Europe. They took a different approach which took them a different route. No mandatory lockdown has been enforced in Sweden. The people are able to move freely within their country as well as across the Swedish border, which may be difficult as their neighboring countries will most likely prohibit them from entering. The Public Health Agency of Sweden does not currently consider it necessary to close all schools in Sweden, as there is yet no known scientific evidence indicating that such an intervention would have any significant impact on the pandemic. Also, all public gatherings and events with more than 50 people are banned. Sweden's different approach relates to the consequential approach in handling the situation. They knew of how initiating lockdown in the whole country will have a huge impact on their economy if they were to shut down most of their businesses and organizations for a long period of time. If people were to be placed in a total lockdown, Workers won't be able to go to their respective jobs, and that would be an absolute nothingness for the society. Their strategy was to protect the vulnerable, while allowing the virus to spread through healthy people so they can develop antibodies. This idea is called herd immunity. What they disregarded as a consequence of this decision of theirs is how the number of cases began to increase rapidly, that almost 70,000 of their citizens contracted the virus because of the lack of strictness being implemented across the country, since they believe that their people are responsible enough to follow the most basic of protocols.
Number 6. United States of America.
Having a total of 2.68 million cases became a rough patch for them, especially with only 825,781 recovered cases were reported. With different states implementing their own strategies, especially the state of Florida, they closed their several beaches to tamp down large gatherings of people, especially on the anticipated spring break. However, thousands of citizens don't seem to abide the social distancing rule, as they force themselves to still visit beaches. The White House was clear of their released guidelines. However, people from different states gathered without masks to demonstrate their civil rights, opposing the imposed lockdown and social distancing measures. When it comes to their strategies, it closely relates to the hedonistic approach. Hedonism has many types, but its essence lies in the pursuit of pleasure and avoidance of pain. The Spring Breakers in Florida clearly shows the moral and ethical concept of hedonistic egoism, which is defined by a reckless lack of foresight. Hedonistic egoism in theory is doing whatever makes us the happiest, without any ascribed value for the consequences it might bring. The anti-lockdown protesters, however, demonstrates the idea of motivational hedonism. It is the theory that our desire to encounter pleasure and avoid pain guides our behavior. The anxiety of a business owner on losing money amid the pandemic will ultimately motivate him or her to join the protest about issuing statewide lockdown order.
In general, each of the country's policies led to their own success. While other countries are still struggling, let us always be disciplined, cooperative, and mindful of the protocols that the government has implemented for us. It is our job to follow, and it is the government's job to execute the best plan there is. As always, let us be safe and God bless.